It's spring in North Carolina. The world feels a little more normal. COVID cases are going down.
Are on the decline.
But health experts say one thing from the pandemic won't be going away: what it did to our kids.
I just couldn't be myself in isolation.
I guess I sort of felt trapped.
While adults fought about masks, mandates, and the vaccine, young people listened and took it all in.
My dad was on the front lines for COVID patients.
Most of them at home or in their rooms for 2 years.
My bedroom was probably a gift and a curse because I spent so much time in here.
Everybody good?
Going back to in-person school wasn't easy either. 1 in 5 young people experienced anxiety or depression. 1 in 5.
I definitely deal with anxiety.
And I became somewhat depressed.
And now suicide is the leading cause of death for children ages 10 to 14.
What do we do now?
The part that we're going to struggle with for quite some time is the mental health piece.
Why is it so hard to connect kids who need help with that help?
It's complicated by a lack of workforce.
How can we help them? Is the state doing enough?
I would like to address our policymakers.
These middle and high school students from across North Carolina agreed to sit down and talk about COVID, the pandemic, and their mental health. These experts did too.
It is absolutely a crisis.
This is the pandemic generation.
Okay, who wants to go first? You want to go? Okay.
Have a seat right there.
Yeah, that's perfect. You're going to do great. Thank you so much for doing this.
Okay, we are ready and recording all the way around. All right, just give me one of these.
Okay.
What was it like to be a kid during all of this?
It doesn't feel like it actually happened. It kind of feels like I wasn't even in 5th grade 2 years ago. It feels like it was a whole lifetime ago.
It feels like I went through a portal and time stayed the same, but now like everything's different. So it's a little bit weird.
It's just like everything is different. The world is a different place, basically. Those years that we went through, they're gone. I don't remember them.
It was kind of lonely because when we were online, a lot of people didn't want to have to turn their cameras on and unmute themselves and talk.
To say the least, probably stressful. Pretty isolated too.
Do you feel like a different person from when it started until now?
Yes, spiritually, mentally, and physically.
Do you think adults realize how hard this was on kids?
All they said was, oh, this is an unprecedented time. I'm like, yes, but adults, they know kind of how to deal with life a little more because they've lived through other stuff before and we haven't.
What was the hardest part of these last 2 years?
Not being able to see family or friends.
Every day, I think I'd stay in PJs just about more than half the day until like one of my parents came home for their lunch break and told me to change.
You know, stressing about my grandparents and if they were going to get sick, I think that kept me up at night, for sure.
I was in the middle of a soccer season, and then it was like a snap of a finger, and it just stopped.
I think for me, it was just the uncertainty of the pandemic. Everything was just up in the air, and you didn't know what was going to happen. You didn't know if you were going to go back to school at the start. You didn't know if you could see your friends, grocery stores, masks at the beginning.
We missed out on so many opportunities.
What would I give to live where you are?
I was in a musical. I was Ariel in The Little Mermaid. A week before we were going to perform, all my family had tickets, and everything just completely shut down, and I remember that day very distinctly.
When I didn't have contact with a lot of people, I kind of felt left out, and I began to feel kind of isolated and a little bit hopeless because I stopped seeing people, I stopped going out. It became easier to stay in and just be alone, I guess.
It wasn't good for me. It was just too much isolation and it was too fast, it was too sudden.
And I think getting, out of my bedroom and back into the world was a little harder than it should have been because I was so used to being by myself.
The hardest part was just finally talking to people again after you've been in quarantine for so long and you haven't really been social with anybody.
I definitely think it felt weird coming back. I definitely noticed people, they acted a little bit different than they had before.
In-person school to online school, and then to hybrid school, and then to school with masks on. I think having to go back to doing these normal day things and normal people things has been pretty hard, and it's pretty anxiety inducing.
I definitely experienced anxiety. I wasn't sure who I was anymore, so I just didn't know how I was gonna reintegrate myself into the community. I didn't know how it was all gonna work.
I worry that we're gonna all be socially awkward and we aren't really gonna know who we are or where we fit in, and that might lead to a whole new road of mental health issues for the future.
Across the state, we're hearing from parents, we're hearing from pediatricians, sort of skyrocketing numbers of children who have anxiety, depression, suicidal ideation, and we simply don't have the services in place to care for the children.
Before, maybe it was one child in the classroom, 1 in 20 would have something that really rose to the level of a clinical symptom, and now it's 1 in 5. And so that I think that scale is hard for us to understand and to sit with.
A lot of the experts we talked to said anxiety and depression really increased among young people, 1 in 5. Did you experience that? And if so, what was that like?
I experienced a lot of anxiety during the pandemic.
Yes. I was diagnosed before the pandemic, though.
I definitely deal with anxiety.
Yeah, I am actually diagnosed with anxiety and depression, and I have to take medication for it. And I think that I started with my medication when COVID hit, because it was pretty manageable until the point when COVID hit, and that's when everything kind of just went downhill from there.
And I became somewhat depressed. I just lying around in bed and just being completely alone became normal for me, and anxiety was something that became an issue.
Definitely. So everything kind of had a gray shade on it.
I think anxiety and depression and mental health, it comes from being alone and in your head and by yourself. And in the pandemic, that's a physical, real representation of how that is in your head.
What did it feel like having anxiety during the pandemic?
It was just kind of this weight that was on you, and you didn't know how to lift it.
Dread all the time, and stomach aches and headaches and sweaty palms, and that sort of the general feeling of just always feeling a little bit sick, which is scary during a pandemic.
It was probably there before the pandemic, but the pandemic really made me grapple with how I was feeling.
I think that not all of that came from the pandemic. I think it just pulled back the curtain. I think that there has always been anxiety and depression in teens, and that first the stigma is starting to come off, and that kind of aligned with the timing.
COVID numbers are going down. Is this going to go away?
No. It could be a lifetime thing that a lot of these kids are going to be facing.
I think that we're really going to have to dig in. If not, we're going to be in this for a long, long time.
This sounds so dire. What can parents do?
I think a parent has an incredibly powerful role with their child.
And see right there, right? Yeah, right there.
And you're going to be right here.
So this is the chair.
We are ready.
Okay, great. What have these last 2 years been like as a mom?
Oh gosh. Challenging, painful, and a new lesson in resilience.
As a mom of 2 teenage boys, I really truly understand what it is to be navigating this and still trying to get through adolescence.
It's been 2 years now. So a 5-year-old, it's been 40% of their lifespan, which is remarkable.
As kids get older, they start thinking, is there a future for me? And so that's where we're seeing some increases in suicidal ideation.
And I mean, you're crying.
I've been a parent who has really watched her kids struggle, and it's heartbreaking and it's hard. And again, we have resources, so my kids were able to get resources, then they're fine. But a lot of kids don't have those resources.
The hard thing is, just as we're seeing more and more need for mental health, we're also seeing fewer and fewer mental health services available.
The workforce was inadequate for what we had before the pandemic, and now the need is tripled or quadrupled.
I think our mental health system is really overburdened.
There's just no openings, so we don't have enough mental health clinicians who are trained and who are open and available to take new clients and help young people.
So there are about 26,000 licensed behavioral professionals in North Carolina, and that includes social workers, psychologists, psychiatrists, counselors, marriage and family therapists, and addiction professionals. The need has skyrocketed. Their wait lists are about 3 to 6 months long, and it's even higher for those in rural areas.
In the Triangle, people are struggling to find providers. I can only imagine what it's like in the rural areas.
So for someone to be told, you're going to be in a wait list for 10 months and that you just are going to have to wait it out until someone possibly becomes available, that can be very detrimental to someone.
Most counties have none. I mean, I think it's like over 60 counties have no child psychiatrists.
Why are there so few?
I think that it is related to training and the ability to have a system, a health system that supports physicians in this field. Other states like Texas have actually invested in a dramatic increase in funding and supporting child psychiatry training.
I keep hearing there are not enough people to help kids with mental health. Why is that?
I think payment has a great deal to do with it.
Providers and my association have been fighting for years to get adequate reimbursement for their services.
Because it's time consuming to conduct a mental health visit. Maybe I can see 5 patients an hour. They might just see 1 patient an hour. And I'll guarantee you their payment is not 5 times what mine is for an office visit. And we need to look at that.
Literally, the insurance companies, both private, federal, and state funded, paying providers their worth.
We also don't have in schools where kids are enough support, health support, mental health support staff to really help kids.
The way we address it is addressing children where they are in schools.
I wish more mental health services, especially in schools, were more accessible to students. I feel like we should have more counselors and people that have a lot of knowledge about mental health helping us.
When kids are struggling with mental health issues, they often go to nurses first or the school social workers. And the school social workers are also overwhelmed because there's just not enough of them in our schools.
So the ratio is really out of control.
We have just not seen the legislature invest in the schools the way that our kids need them to.
I would like to address our policymakers and say that they need to increase accessibility to mental health care so that our communities can all heal, because it's going to be impossible to support the children in the upcoming generations if we're not on a solid foundation.
This sounds so dire. What can parents do?
I think parents need to trust their intuition. So if they are worried about their child, changes in behavior, changes in mood, they definitely should talk to their pediatrician or family physician.
I know that if they contact me, their primary care physician, I have some inroads with the system that they don't have.
And also making sure that you're keeping the lines of communication open with your child.
So we as adults actually have to start that conversation. So listening, asking how does it feel? I know that sounds sort of, coming from a psychologist, and how does that make you feel? But we do need to ask that question.
And a lot of times that fear or that stigma is hindering people from getting the help that they need. So just making mental health a normal conversation in schools and in your family could be very life-saving for someone.
My son and my daughter, their generation, are very open about talking about their feelings. And in some ways, they model what good looks like for her father and myself.
Because I feel like older generations kind of still see mental health as almost an anomaly, but I feel like for most people my age, it's like everyone and their mother has some form of anxiety or deals with that.
So that's what's giving me hope through all of this, is that they are talking about mental health. They are saying, we're not gonna let these kind of burdens of previous generations wear us down.
Why do you think it's good to talk about it?
It just tells you that you're not alone.
Knowing that I wasn't the only one and I wasn't really struggling on my own.
I really don't think I would have been this open before the pandemic. I think my community around me has normalized feeling depressed, anxious, stressed, whatever it may be.
It's just listening to them. They're struggling with a lot. And sometimes we want to go in and fix and make it better for them. But sometimes all that's needed is, a listening ear.
I think just adults, just listen. If your child needs to vent to you or just needs to talk to you about something, put down the distractions and just listen. We don't need you to fix the situation. We just need you to listen.
What gives you hope?
This has been a bad experience for us, but I know that we can get past it. We can use what we've learned to get better.
Have a seat right there.
You're going to do great.
Okay, we were ready, Kristen.
All right, here we go. What would you say to parents watching who want to help their kids?
I think it's really important that your child knows that they're not alone.
Just let your kids know that you understand what they're going through. Try to see it from their point of view.
And also to cut us a little bit of slack, because it was definitely a rough 2 years for us to have to go through, especially a lot of us went through this at a pretty young age.
I don't think anybody else can really understand what our generation went through, because nobody else, it hasn't happened to other people really.
And what would you say to parents right now watching?
I would say, one, all of the children are struggling. This is not inherently you. This is not inherently your child. Everyone struggles. It just manifests in different ways.
We've all heard, well, children are really resilient. But just because most children are resilient doesn't mean we don't do anything.
And we're just now starting to talk about how big of a challenge this is going to be. And I just hope we're ready to do what we need to do in terms of investing and building the services for the kids.
If we just keep doing the same thing we've always done, I think we're going to have numbers that are much worse.
What gives you hope moving forward?
I think just seeing how the numbers are declining and all of the medical and factual evidence that there is.
COVID numbers are going down and that things are going to get a little bit closer to getting better, and just that we're going to come together a little bit more.
I think what gives me hope is that people are starting to figure out what this all is, and it's settling down a little bit.
But we did this, I mean, it came out of nowhere, and we got it under control as best we could. But I think we're all going to be okay.
Just kind of cross my fingers that everything will get better eventually.
What gives me hope is just my family and my friends, because being surrounded by a lot of love and support helps me keep going when I feel like I can't.
This has been a bad experience for us, but I know that we can get past it. Like, we can use what we've learned to get better.
The last couple of years have been, they came with a lot of challenges, but I think that our generation and our country in general is healing, and we are going to come out of this stronger.
I really am not worried about my generation because I think that this pandemic has instilled resiliency within us.
I think it's really nice to see and realize through it all, we're still growing up and being kids and just getting older. And that's pretty nice, pretty hopeful. I'm proud of myself, proud of us.
And teenagers, it will get better.
Thank you so much. Are you so proud? Sheesh. So good.
Wow.
So good. Thank you.
Yeah.
You did great.
Yes.
Thank you. Thank you so much. So good. Thank you. Thank you so much. Okay, that's it.